After years of seeing an increase in drug-related deaths, La Crosse County officials say they've reached a record low with 0 deaths so far this year. News 8's Keely Arthur has more on how efforts by the county and other groups have led to the decline.
I had several years, I'm afraid, worth of drugs, including prescription drugs at my house.
Maureen Friedland wanted those drugs gone.
I'm concerned that the drugs not get into the right hands.
So she got rid of them at a drop box at the La Crosse police station.
I didn't have to fill out any forms. I didn't have to identify anything. I just walked in, I dropped my pills in here, and that was it.
Police say abuse of prescription drugs can be a slippery slope.
What happens is if they get in the wrong hands, the prescription drugs get used improperly, and then that could lead to heroin or other drug use.
What we're seeing in La Crosse County is probably a first. We have not had a drug-related overdose this year.
La Crosse County Medical Examiner Tim Candle says recently installed drop boxes and other new tools help curb drug-related deaths.
We consistently have been running around 10 to 12 overdoses a year. And with the education from the heroin task force and some of our committees that have been working on the drug job, I feel that this is a helping benefit to preventing the overdoses.
Aside from prevention, people who overdose are less likely to die thanks to a drug that counteracts a heroin overdose.
Without that treatment, then my caseload would probably be not 0.
This year, Wisconsin Governor Scott Walker signed a bill that allows emergency responders to administer Narcan. The La Crosse Fire Department started using it this January and says it made all the difference.
And the problems with the narcotics, primarily with heroin, is that it's a respiratory depressant, and when they overdose, it will be fatal to the patient. So what Narcan does is acts almost instantly to block that and reverse those effects.
In La Crosse, Keely Arthur, News 8.
The La Crosse Fire Department reports using Narcan about twice a month on patients. Last year, Tri-State Ambulance used it more than 200 times.